right, chapter 29, part 2, going into further of fluid volume imbalances. All right, a fluid volume deficit or hypovolemia. What are some signs and symptoms you would expect to see with your patients? All right, is that dehydration? And then what about children? So when we're thinking of our children, smaller body composition, so they would have a tendency to get fluid volume deficit quicker. So out in the heat, you'd have to be careful. They can get more imbalances with heat-related or cold-related instances. All right, so what are our hormones that actually help regulate our fluid levels? As I mentioned earlier, ADH, ANF. You need to know those two, where they come from and what their purpose is in the body, and okay, how they regulate it. Box 29.2 gives a definition of how they work, how they regulate, where they come from. What do we do as a nurse with somebody with fluid volume deficit? All right, we're going to replace the fluids, monitor vital signs for low blood pressure, elevated pulse, elevated temperature, measure the eyes and nose. All right, output should be equal to or within a 300 to 500 mils of total intake. So if you see a drastic imbalance between the two, then that's going to be cause for concern. Right, and again, less than 30 milliliters of urine per hour output can indicate renal problems, severe dehydration, which can lead to renal problems. Okay, box 29.3 has our signs and symptoms of our fluid volume deficit. You need to know those. Fluid volume excess. So now we're going the opposite. So now we had fluid volume deficit. Now we have fluid volume excess. So now we have too much fluid. What are our signs going to be? We spoke about this in the urinary system. Bloating, edema, okay, pink or frothy sputum, weight gain, increased urine production. All right, jugular vein distension. Why? Why would we have this jugular vein distension if we have excess fluid? What are some of the complications of this excess fluid? What are our nursing interventions are we going to do? Okay. Diuretics and potassium, as I said in the first video, need to recognize hypokalemia, hyperkalemia, and what about our diuretics and how do they work with potassium and why? And what are we doing now? What are some of our interventions that we would do? All right, electrolytes. What is an electrolyte? Okay. So when they're dissolved in water, they either have a positive or a negative electrical charge, okay, called our ions. So remember the other day when we were talking about calcium and ionized calcium. Okay, so an anion, A-N-I-O-N, is negatively charged. Cation, C-A-T-I-O-N, is positively charged. So sodium and potassium are positively charged. Chloride is negatively charged. All right, table 29.3 breaks them all down. Their normal range, you need to know all those normal ranges, their functions, sources of intake. So where do they get them from? All right, so one of the imbalances that you will see quite often is sodium. Okay, sodium is a hypovolemia. natremia, right? Excess is hyper. So you need to know, remember to recognize those two words. Hypo is low, hyper is high. All right, table 29.4 breaks down the imbalances, signs and symptoms. All right, so sodium, big one, need to know. Potassium, magnesium, calcium. All right, be familiar with those. And what are our interventions for, especially for sodium? What do we do if somebody has an imbalance in sodium? And what are you going to see? Okay, calcium. So let's go into our calcium. And we talked about, you have your calcium 2+, which is the mineral in our bodies, combined with phosphorus, teeth and bones, right? We have our ionized calcium, which is in the body, and that stimulates your electrical impulses. Vitamin D is required for the absorption of calcium from the GI tract. All right. So hypocalcemia is what? Low calcium. Hyper is too much in the blood. Okay, 29.4 again breaks down the complications. So if somebody's getting calcium supplements, what are some concerns? Okay, so calcium can cause bradycardia. So IV calcium, if you're getting somebody, should you have them on telemetry so you're watching their heart rate? Should you be monitoring your patient closely? Okay, magnesium. We spoke the other day about magnesium and potassium. So 50 to 60% of your magnesium is found in your bones. Okay. Magnesium also works with potassium and calcium. So they're linked. So the three of them, calcium, magnesium, and potassium, work together. So if one is low, you need to make sure that we're checking the other ones. Okay, decreased levels of magnesium can affect the nervous system. All right, back to our acid-base balances. Right. So 7.35 to 7.45 is our normal pH. Okay, how do we regulate our pH? We have three systems that work together. The carbonic acid buffer system, the respiratory system, CO2 and O2, and then the renal system. So you need to be familiar with those three systems and how they regulate our acid-base balance. So what is respiratory alkalosis? All right, so you'll see then that's your hyperventilation. They're trying to blow off excess, right? They're trying to get back into their normal pH system. Then you have respiratory acidosis. Deep breathe, okay, and they'll retain the carbon dioxide. Metabolic alkalosis, okay, so we have a loss of hydrogen ions, an increase of sodium bicarb will lead into our metabolic alkalosis. Severe vomiting can do this if we're nasogastric suctioning things. So G tube, and it's going to the wall. It's pulling out all the gastric juices, right? Antacids. So think of your antacids. That can actually put somebody, because they're alkaline, can put them into metabolic alkalosis. And then we have metabolic acidosis. So then we have an increase in hydrogen or a very low level of bicarb ions. So again, everything is out of whack, right? Kidney failure will go into metabolic acidosis. One of the reasons, okay? Lactic acidosis, you may have heard that one before. Shock or ketoacidosis. So diabetics go into ketoacidosis. Okay, so what are some of our actions that we would do for our patients that are either in respiratory alkalosis, respiratory acidosis, metabolic alkalosis, and metabolic acidosis? Okay, the body is going to always compensate for these conditions, and we will work on some of these problems in the morning to recognize which one they're in and how they compensate.